an organization in the chat, so we have it for record keeping purposes. I know teams will take it also and do attendance, but just in case uh, just humor us, please. And it helps for the rest of those of us in the room as well. And if you are new, is there anybody new? I definitely want to start with you all as we're introducing ourselves.
Okay, don't be shy. Well, we're going to go ahead.
Emma Bong's note taker. I don't know if Emma Bong's actually in here. I don't see. Okay. No worries. Well, welcome to the note taker.
Well, happy 2025, everyone. And thank you again for joining us this afternoon. And if you have not done so, please take this opportunity to introduce yourself and tell us your name, the organization that you represent. And we're going to get into an icebreaker. And that question is, what is one task, whether it's personal or professional, you want to accomplish in 2025? And if you can document that into the chat, we would greatly appreciate it.
And if you don't want to put it in the chat and you want to come off mute, you can also do that. It's not a test. So.
No.
We're not going to evaluate this at the end of December.
So I am on a mission. This is Sharon. I'm on a mission to clear out all unnecessary paper, and that's both personal and professional. I am a paper hoarder, and so I have my tax returns from when I was 16 years old. I don't really need them anymore.
Knock on wood, Sharon.
Yes. And it's just, it piles up, and then it gets overwhelming. So you have to piece it apart again and then start throwing and shredding and whatever.
That's a great goal. And I should adopt that myself, because I too have paper from the 1900s. Let me just put it that way.
Yeah.
Sounds horrible when you say that.
See, anybody else for more exercise and reading more?
I see reading more.
Don't be shy. Or is it just that you've done this too many times this year already? Hopefully not. I see Judy said get more sleep. That's a good one. It's important for our health. Is anybody else getting feedback when I talk?
Good afternoon, it's Dr. Levy. I'm in the car. I'm going to be on mute, but I'm here and I'm going to listen.
Welcome, Dr. Levy. See, quite a few people get more sleep. Okay. I guess more organized. I like that too. Recipes.
Okay. We can enhance our coalition recipe book that I promised you all after the holidays, after Judy's stuffin' muffins. So Amanda will definitely be in contact with you to take on a chapter of that.
I see more personal reading and getting more sleep. It's personal reading. I did catch that. That is very important because sometimes we do a lot of reading and it has nothing to do with anything we want. I like that. I had a colleague who said they read 72 books last year, which I thought was really impressive.
Absolutely.
I'm just curious, am I the feedback? You hearing feedback with me, with me unmuted?
No.
Nope.
Okay.
Dr. Levy, do you have anything you're hoping to accomplish in the new year?
Personally or professionally?
Either or and.
I want our health department to finish our strategic plan and work with the community and start driving some big changes.
I think that's excellent.
Personally, let's see. I heard someone say they were going to get more sleep. I like that idea. And I am going to continue to learn Spanish so I can be fluent at some point in my life. I think that's a good starting point.
Okay, does anyone else care to share?
I think there is feedback when Dr. Levy's unmuted.
Yeah, I think that's what I'm starting to realize because it wasn't me necessarily. I've heard it was several. All right. Well, thank you for sharing. It's great to kind of start off the year to reflect on what we want to do. So again, thank you. And I don't know, are there any new attendees that we would just want to highlight or introduce themselves? Okay, I didn't want to.
I can speak. I was here last month, and
You're
I think
here last month. Mhm.
yeah.
Go ahead,
I think
Judita.
a couple of my colleagues from La Clinica are joining us for today. So, yes.
Oh, welcome. And welcome to your other colleagues. If you all want to share who you are, let us know, or we could check the chat.
Hi, my name is Lina Guerrero. I am the Community Partnership Manager at La Clinica at the Health Equity Department.
Awesome. Welcome, Lena.
And hi, my name is Abril, and I'm the Senior Health Equity Coordinator also on the Health Equity team at La Clinica. It's nice to meet you all.
Wonderful. Thank you. It's great to have representation from La Clinica again. I know, I know we used to, but your folks get so busy and are stretched so much. So it's wonderful to have you all here again. All right. So yeah, so thank you. So after the welcome, so we do want to talk about our 2024 health equity workgroup successes, do some forward thinking for 2025, and then just wrap up at the end with typical reminders and community announcements. So, I mean, just as a reminder, our vision is to have a Prince George's County that is a place where everyone has equitable access to achieve their full health and wellness potential, regardless of race, color, religion, country of origin, immigration status, class, age, disability, sexual orientation, gender identity, or health literacy skills.
And let's just recap our 2024 Health Equity Workgroup successes. And that's always good to find, basically regroup as far as what we have accomplished and use that as a foundation as far as moving forward. And our goal number one is to advocate for the implementation of health in all policies, HIAP CR-127-2020. And the objective associated with that goal would be to train residents and community leaders in the health in all policies, health equity concepts, empowering them to speak to the Board of Health about their health equity priorities. And then we go through the strategies. And the first strategy is to collaborate with the University of Maryland Office of Public Health Practice and Community Engagement, Terrapin think tank, to develop a health equity champions curriculum. The second strategy is to develop a pre and post program learner survey to measure the change in learning confidence and advocating for health in all policies to the BOH after completing the Health Equity Champions program. Our third strategy is to implement the pilot Health Equity Champion program to at least 50 residents and community leaders. And then the fourth is to develop a lesson plan or lessons learned report and improvement plan from the HE pilot, Health Equity Pilot. And that's always good to measure the impact and the efficacy of the program. As far as updates, our goal is to identify a health equity resource inventory as an intermediary next step, focusing on 3 modules. 1, health equity introduction and best practices. 2, organizational health literacy and advocacy. And 3, civic engagement, engaging local leadership in health and all policy initiatives. And then next step is to monitor the health equity resource inventory process measures quarterly to inform development of a health equity champion curriculum. Are there any questions relating to us recapping what our 2024 successes were? Well, we look forward to not only to not rest on the laurels of 2024, but envision what we're going to accomplish also this year and the upcoming years as well.
Thank you for that overview, Dr. Cooper. We think it's really important to take this first meeting of the year to make sure that we are level setting our information and all of the accomplishments that we had in the last year, especially for those who are new joining us. You'll see the theme of this presentation. We want to make sure that we are meeting folks at where they are at in their health equity journey. And that goes especially for the folks who are joining us in this work group for the first time. So we want to make sure that folks are able to join the work group and really hit the ground running. So we're hoping that in making sure that we are doing adequate recaps, that we are keeping folks in the fold, and then also making sure that we are building out orientation materials behind the scenes. So we're going to ask you all for some feedback today to hopefully be able to build those orientation materials for our new members who want to join the work group, as well as setting our priorities in the new year that we are in. So just want to give a really quick recap going off of our last meeting, so our December 2024 health equity meeting, and then what Dr. Cooper just shared there, talking about that resource inventory. So again, for those who are just now joining us, this work group set out after doing an environmental scan of health equity resources that were out there and identified the need for Prince George's County-based resources. And so in building out a curriculum, the work group identified a resource inventory as a good intermediary next step. So that's where we're at with the resource inventory. I can put the link here in the chat for those, again, who are joining us today, so you can take a look at it and be able to have a little more familiarity of what we are talking about. But just want to give a huge shout out to all of the partners who took a look at that inventory. We know that this has been a repetitive process of fine-tuning that resource inventory and making sure that it is inclusive of the resources that we want to be able to share with community members to equip them with the health equity knowledge and the advocacy knowledge to be able to advocate for a health in all policies approach moving forward, and to be able to advocate for health equity priorities here in Prince George's County. So with that being said, a few updates for you all. We received some feedback on how to make that resource inventory more accessible. We are working with Ray Wallace, who has joined a few of our calls prior, who's building out the resource inventory, to talk to her about how we can add those features, see what is available to us, and hopefully make it more accessible for a community member who is maybe new to our website, who is joining for the first time, to be able to access those different resources and the definitions and all of the good hyperlinks that we have. And then we are also developing a section to suggest resources. So again, we talk about this iterative process of continuing to update the resource inventory. So we want community members to be able to give their input. What is pertinent to the community? What do they want to know? Again, and focusing on this mission to meet folks where they are at in their health equity journey, we want to make sure that we are responding to the needs of the community. So we'll have a suggestion section on the resource inventory where folks can add resources or be able to suggest a future material. We will also add that assessment piece and acknowledging that this work group set out for this goal of creating the health equity champions curriculum. We want to make sure that we are using this resource inventory to collect information that will then inform that curriculum. So that assessment will contain questions that we discussed in our last meeting, including areas of interest. We'll be able to take a look and see where folks logging in from, where are folks going on the web page? What are they especially paying attention to? Dr. Cooper went over those 3 modules earlier, and so we'll be able to take a look and see, oh, are folks interested in the health literacy piece? Are folks interested in the advocacy section of the inventory? And we'll be able to then take all of that information and inform a curriculum moving forward. So we'll be sure to add that assessment piece there, and that will help us go along on a quarterly schedule, be able to share with the work group the successes, any gaps in information, and hopefully continue to refine this process and refine that resource inventory to be most receptive of the community needs and what assets we currently have and are able to highlight on this inventory. Lastly, we had a really great December meeting talking about the distribution plan. So want to give a huge shout out to everyone who has given additional feedback related to areas to make sure that we are promoting this inventory. We want to be able to share the success with the health department and beyond. And especially we know that health equity takes all sectors. It takes us all. So we want to make sure that we are expanding beyond just those who are in the conventional quote unquote public health field. We want to make sure that we are being receptive to all of our partners across the entire continuum who are necessary to make all Prince Georgians their healthiest at every age and every stage. So I am continuing to do some research in the background, locating those names and specific contact information. I will most likely reach out to you all to get those specific names if you did offer up coalitions or other work groups to share this information to. So just be on that lookout for any future emails, and I will have us a list pretty soon here to start distributing that resource inventory. So thank you again for all of your hard work. This is a much community-driven, community-owned success. Really happy to see this come to fruition for you all. And thank you all for having just taking this on and shooting for the stars. You all have accomplished so much, and really looking forward to seeing the impact that this inventory has. So I will stop there. Any questions, or Dr. Cooper or Christine, did I miss anything?
Don't think so. The only other thing in terms of the collecting feedback on the inventory, I think at a future meeting, we'd want to just crowdsource and get a better sense to add on to some of the evaluation and analytics. So in addition to analytics, what other information might we want to pull from those who are visiting the website, and figuring out how that can support the development of the actual champions program. Sharon, I see your hand.
Yeah, just for clarification for me, but also for people who are new, there was a curriculum developed, so it's there, but is it posted? Is the curriculum that we had developed also posted on the website? We had developed some modules.
Yes, so the Terrapin think tank, they created 4 modules for us. what we did for the inventory is we extracted several of the resources that they cited, and they gave us more of a facilitation guide. So that will be helpful as we start to circle back to that larger facilitation piece for that in-person or virtual curriculum. We'll be able to take that that guide that they've created for us and take the information that we get, the feedback we get from the resource inventory, and continue to enhance that.
Okay, so the 4-module curriculum then is, we haven't really implemented that. That's correct, right? You know, I guess I'm wondering if as people enter, if there was a way, and this is a thought that's forming in my head as I speak, so bear with me. If there's a way when somebody goes onto the website, maybe there's, you know, a 3-question survey that they can answer prior to actually going in and searching, asking a couple of things about, you know, what's your experience with health equity, or where is your interest in health equity? You know, what kind of information are you specifically looking for? And are you or your organization interested in additional training and resources on health equity, which would give us kind of some sense of the type of people who are searching and what their organizational or personal needs are related to health equity.
You know, that's interesting, Sherry, because I actually was thinking similar, but like on a different end. So now that you've consumed this, how else, what's the next step for you? What are you interested in? What type of program? Questions closer to finding out how we could best meet the needs of the community after they've interacted, but that's another approach as well.
Yeah, you could do both, you know, sort of
Mhm.
a pre, why are you coming here, and a post, did you get what you needed, and if not, you know, what more would you need? What more can we help you with? Might be a way to do it. And I'm also thinking of perhaps using something like either a pre and or post as a marketing tool to say, you know, we have this curriculum. Is this something you might be interested in using or having or participating in the future? You know, something like that. So we start to get a sense of interest. And you know, it's a shame because we do have those 4 modules to not push them out or make them available to people to use.
Well, I mean, well, and it's not that we're not using them, because I think part of it was, so they're not, we have to figure out what is the next step in terms of what does it look like? Is it live? Instructor led? We probably don't have the resources for that. And if it's, and then the next step, if it's not, then it has to be packaged in a way that it can be done asynchronously. So, if that's the correct term. But yeah, I think we definitely want to get to a point where it's used, and so you're actually using the resources that this team, this organization, this work group has put together, as the next step. And hopefully also having it informed by those who are interacting with the resource inventory. But I think we can be flexible, and this is a good time. January is always a good time to think about goals and process. And I also see Amanda, I see your hand is raised, and you added some resources as well.
Yes. Hi. This is a little bit not related to the conversation. So if you wanted to finish that thought up, but it's more about accessibility of the website, because I was on the meeting with Ray also. Yes, I do work in the dark. Sorry, I'm like in the dark right now, but it's good for me. I was on the meeting with Ray last time when she was discussing like using headers and the hyperlinks to make it most accessible. And we just attended this like webinar yesterday about digital accessibility. And I just linked the slides because um, a lot of people, I didn't know this, but a lot of people who use screen readers rely on headings to navigate information. And without headings, they like the screen reader reads it as just like a list. And then they have to go through the whole list to find the specific topic or section that they are interested in or are useful to them. And then the PowerPoint just goes through like more accessibility tips. But another resource I put in was from the Horowitz Center, which I'm representing, and that's our web content review tool. I don't know if our director, Dr. Bauer, sent over this resource yet, but could be helpful. And I also just wanted to say, as a former community health student at University of Maryland, I'm so excited for this initiative, and it sounds great. And we'd love to offer our support and whatever you need regarding accessibility moving forward in this project.
Yeah, wonderful, Amanda. Thank you so much for the input. And I think there's still opportunity to offer formal input or I'm looking at Taylor to make sure I'm not misspeaking, because I don't want to misrepresent, or we don't want to misrepresent what you've shared and translate it in other ways. So there's a separate Google form, right, Taylor, or no?
Yes, I am putting that right now in the chat. So folks leave this meeting feeling inspired. Please feel free to add any feedback. Again, that can be content related or accessibility related. And we can leave that open through the end of next week if folks are able to provide feedback. But of course, if that's a barrier, just feel free to email me.
And I do know from our meetings with Ray that sometimes the structure that she's working through is like a larger structure county-wide. So she's done a lot of work. It's not as simple as working on, your organization, a smaller organization's website. I think this what she had to manipulate impacted structure or came from county level. So not just the health department or the PG Health Zone page or even this resource inventory. So I'm sure any of the feedback and improvements would be beneficial to the entire county.
Are there any other questions or feedback that you want to provide for this particular area? Okay. Guess we can move on to the next slide.
Yeah, before we do move forward, and I think it's kind of related to this, like, what do we do next, which is coming up. I do want to echo Sharon, I do hear you. I mean, the interest in moving forward and quickly and utilizing the resources that the curriculum that we've put together and bringing that to life. And that will lead us to some of the next questions that we will, next discussion points that we will have during this meeting.
Okay, so now let's look at this year. And I think that was a wonderful segue, Christine, as far as the health equity work group and reflecting and planning. So these are some of the questions that we want folks to really internalize and just think about so that we can look forward to striving to achieve not only what we've accomplished last year, but new areas that we need to target as far as meeting the needs of the community. So looking back on last year, what were what you would think are most meaningful accomplishments as a work group? And what lessons can we carry forward to inform goals and objectives for this present year? I'm going to say upcoming, but present year. So the floor is open, so please. I think one of the things we want to do now that we have this curriculum, one of the things we want to do as far as an action plan is how do we roll this out? How do we, like Taylor mentioned earlier, continuous feedback and putting those measures in place to ensure that these particular initiatives that we have are impactful and that they're meeting the targeted audience's needs, as Sharon had mentioned earlier, and getting to those individuals. I think, again, how do we do that? Who in the community do we need to really speak to? And if you know of any community partners that would be willing to sit on this committee and help to advance those particular steps, this is the time that we need to start thinking in terms of, who they are and map out how we can accomplish those particular goals and objectives. Any thoughts?
I'll just really quickly add, really happy to see our partnerships increasing. I was looking at the attendance sheet the other day, and in 2024, we had 15 new organizations to join. And so who are, attending meetings, who are on our email listserv. So would be curious again to hear all of your thoughts on what do folks need to know as they're joining this work group? What do folks, who's missing from the table? We know that this is by, no far stretch of the imagination, a representative group necessarily of Prince George's County, and we always need to make sure that we are including more and more seats at the table. So if you see anyone, if you're missing a colleague today, please do not hesitate to let us know, and we can reach out to those folks and make sure that they feel welcome and know of this work group.
And maybe we can come back to this question and go on to one of the other related ones.
Oh, it looks like
related
Amanda,
to-
excuse me, it looks
Okay.
like Amanda has her hand up.
Ju-
Amanda?
Yes. Just something quick. I don't know if you've had relations with the Parks and Recreation in the county, but I think health equity can be talked about anywhere, even in like a Zumba class. And those are those third places are where most of these conversations happen. Like you go to the doctors and you're not being heard, and it's because of something that you like, just your race or your age, and that's where people just talk and relate to each other. And I think having a representative from the Parks Department would be great, especially if they're focused on population health or health and wellness in general.
Excellent point. Rodrigo, please share.
Yes, I'm just answering the question on the PowerPoint. What new or emerging challenges have we observed in our community that require our attention? So we actually conducted what we called a rapid appraisal, which is a form of community-based participatory research, which we surveyed, or I usually use surveyed, but we conducted a series of focus groups with affinity groups that receive services at La Clínica. And there is very valuable information on the barriers that the low-income Latino immigrant community, specifically residing in Prince George's County, is identifying. So they were not only able to identify what were the most common health conditions affecting them, but also what the perceived barriers associated with those health conditions. So we would be happy to disseminate that report. We validated the sources with secondary sources and did a process of triangulation. So there's very valuable information relating to PG County, and I'd be happy to share the data with you all. And I think that is something that the
Absolutely.
community is not only aware of the social drivers of health, but also some of the policy recommendations that can be implemented. So as part of the initiative that we followed was not only identifying the barriers, but also developing policy solutions. Be happy to share that.
Great. And just to piggyback on what you said, Rodrigo and Amanda, the University of Maryland, the Center for Health Equity, and their philosophy is meeting people where they are. And that's exactly what I think you both are the concept that you both are really looking at. And basically, they have community health workers within barbershops, within hair salons. So those non-traditional settings where people are open to conversations and the dialogue is there for information to be shared. And not only for health literacy, but also for pre-screening related to cardiovascular disease, related to other chronic diseases. So I think there is opportunity there within the community to not only disseminate the message, but ensuring that it's getting to the appropriate individuals who can not only inform this process, but help us to guide those priorities associated with what we need to accomplish to bridge the gap. Eduardo or Rodrigo, do you have any other questions? Your hand's up.
Sorry, I think I didn't lower it after. It's no further comments.
So I'll definitely reach out to Dr. Thomas, and I'm sure he will be willing to help us out as well. Sharon?
Oops, sorry, I was on mute. I was wondering, Rodrigo, is it possible, do you have a presentation prepared that you might be able to present to this group? Because I think
yes,
I'm worrying in advance about what's going to happen within immigrant communities.
Yes,
given the hostile environment we're about to enter.
Yes.
The answer is yes, because I really feel like it's going to be incumbent on states and localities to preserve and protect the integrity of immigrant communities and people trying to seek services there. And, you know, we all experienced last time, or many of us did, the chilling effect that, you know, when people get scared, they just don't, in addition to all the barriers that exist, the care seeking behavior changes and they're just afraid to come and seek care. So I think as much information as we have would be so helpful.
Thank you. And that's exactly what I was going to ask too, Sharon, if and this isn't just Rodrigo and La Clinica. I think we have space throughout our work plan, our agendas to get these periodic updates from you all, from others in the community. So I think that can aid in our work, whether it's the work of the work group or even just to keep us all informed of what's happening. So thank you both. And thank you, Sharon, for highlighting the upcoming, I'll speak plainly, the change in administration, and how we may need to respond to that on the more local levels, what the impacts are. I think that's something in terms of a new emerging challenge. That's been talked about a lot in wider circles, what the impact is of the changing of the guard on local communities, especially communities such as Prince George's County. And what about innovations that we can bring to Prince George's County? And I'll take a I'll repeat what a colleague of mine has said. Sometimes innovation is not that you are the first person to have ever come up with something, but it is new to the population, to the area, to this county. So it could be happening in Montgomery County. If it's new here, I think it's still being innovative. So to kind of give us freedom in the way we think. Are there things happening in other places, based on your connections, that you think we can adopt and push to have brought to Prince George's County, and as a work group, advocate for those focus? And I see a question from Judy. And while you all are, just the only this, I just wanted to link back to some discussion, like, so shared Dr. Cooper bringing up having CHWs in barbershops. I know, and this is actually happening in Prince George's County, but only in one site maybe. I know one organization has CHW community health workers placed in laundromats, talking about being someplace, being where people are, those third places. So are there other innovative models that we just want to discuss and share amongst each other? And Judy?
Thank you. I was wondering, just so we have a sort of a level playing field, where things are at with the community needs assessments that I know happens. Is a new one happening? As I listen to some of the different folks talking about the concern about the new administration, just understanding where we're at. Where are we with cancer? Where are we with all these different things, and have sort of a level setting that we understand where we are, particularly as if we can drill down at all and look at it amongst different populations or ethnicity or races too. So is there I felt like there was a new one coming out or being worked on. Am I right on that, Taylor? I see you shaking your head yes. Taylor,
Yes,
I see you
Judy.
shaking your head yes.
Yes, Judy.
It may be nice once that's pulled
Yeah,
together. I'm sorry.
no, it's Dr. Levy. We are working on it. It's supposed to come out hopefully within the next month. We're going to be sending it out, and we want to spread this as widely as possible to get as much feedback as possible. So any channels you have, we'll send you the link, send it out to your folks. We really want as much feedback as we can get from the community, so that we can see exactly what's happening and what people think and what the priorities of the community are. So that is coming soon. In the health department, we are doing our own strategic planning now, and we did a different kind of outreach to get to assess the community more with our partners. So some of you might have gotten the survey. Some of you also might haven't been invited to our key informant interview groups that are happening this next Wednesday. But we're really trying to change the way we do business to be more inclusive and certainly community focused. So, but stay tuned for the community health assessment, and then following that will be a CHIP.
Thank you.
And I'll just add,
Thank you.
with the secondary data piece that we've been working on, you all had previously informed those indicators in a previous work group meeting. So we've taken all of the feedback. We talked about how to get at access to care. We took a look at several indicators through a health equity lens. So Deborah's team, Deborah Collier, my colleague in the Office of Assessment and Planning here at the Health Department, she is working very hard to put all of that information together. We are also working with our hospital systems here in Prince George's County to have all of their hospital profile and service profile information put together. And as Dr. Levy mentioned, there will be opportunity to collect the community's voice and be able to tell a most comprehensive community story from those primary data pieces. So we'll have a community resident survey going out to you all for anyone who lives, studies, worships, seeks recreation in Prince George's County. So we'll be asking you all to spread that information out. Dr. Cooper, I see your comment there in the chat, QR codes as well. We'll be making that survey as accessible as we can, have plastering that QR code all over the county, very far and wide. And then we'll also have our key informant interviews to serve as additional primary data. And definitely would like to follow up with you, Rodrigo, to talk about some of those secondary data pieces, as well as we think about telling the most comprehensive community story. So we will keep you all posted as things happen. And thank you all for all of your input that you've given so far. We really couldn't do it without you all.
Speaking of data, I also wanted to call out the sub-bullet asking about whether there are data sources or other reports other than those that are mentioned above. So we have the RAND report, Huron study, Prince George's County Plan 2035. Are there others that this work group or those working around health equity should continue to monitor? We should consider in terms of planning for what our role is in advancing health equity in our county. And just noodle on it.
And Christine, if I could ask a question from the group, I know we've previously thrown out these documents when we were talking about the resource inventory, but I'm just curious, are folks on the call, are you all familiar with all of these documents that exist? So the RAND report, the Huron study, Plan 2035, is that something that we all have a shared awareness of? Or is that something that the work group would be interested in learning more about and really dissecting those documents and taking a look at like Health and Human Services and taking a look and seeing some of that information?
This is Judy. I would be very interested. I'm only familiar with the community health assessment, so I wouldn't know the other, even if, either somebody could do a brief overview of each, kind of a, here's where we stand, here's where we are, not a long presentation, but a very brief overview, or at least give us the links that we can then research it ourselves too, if necessary.
Taylor, I'm actually, if you don't already have them, I'm pulling some of the links. And I don't want to put anybody on the spot. I know some folks, Anya, I know you've already done a short presentation on some of the available, it's like an overview of the RAND report, the Huron study to the Board of Health. Maybe that would be helpful as a primer for the rest of the group, even if we have the slides, and I'm not putting you on the spot to do it all. But that maybe, it sounds like that would be helpful.
Sure, we can work with Taylor to coordinate something like that.
Do we want to move on? I'm just looking at, in the interest of time, Taylor, should we move on to, and Dr. Cooper, do you think we should go on to some of the others? So the next set of questions is really about expanding our reach. And because I have another question on top of what you see here, but Dr. Cooper, did you want to facilitate this section?
No, you can go ahead. I think
Okay.
again, what we've talked about in our previous work group meetings is, again, looking at our resources once we identify them, leverage those resources so that we can truly continue to make impactful decisions and create impactful initiatives that will help us, again, close those gaps and create a equity-centric environment.
And actually, Taylor, do you mind if we ask the next question first? Sorry, I didn't provide this feedback as I'm walking through it.
Do you want to go to the next slide?
Yeah, and then come back to this one. Because I want to nurture and talk about your those who are here already and the experience. So we've been talking a lot about just retention of members, retention and having people come back. What changes or improvements can we make to ensure that those who, we say volunteers, we are all volunteers, all of you have a more impactful and rewarding experience when you come to these meetings for the work group? Overall, what makes you come back from month to month?
And if I may add something to that question, what do you see yourself or envision yourself in the role as a part of this work group as well? And if you don't feel comfortable in saying it, you can put it in the chat, and you can always, again, we can circle back to this at a later time, but we just want you to envision how, with your skill sets and your capabilities, how can we, again, use that in order to be more innovative and impactful within the community.
What makes you want to come back?
Okay, I'll chime in. I think that it is really rewarding when some of the things that we discuss actually come to fruition, and when we are able to move the discourse and the conversation from our more intimate group into a broader public domain. So last year, when you guys came to testify to support Health and All Policies efforts, when we resurrected them as a part of the Board of Health discussion, like honestly, that was wonderful, and I always really applaud this group because during the COVID time, we were supposed to be doing a lot of work on Health and All Policies, but COVID took over, and this kind of like Health and All Policies conversation took more of a backseat So, but I always reference this group and this work group, right? And that this is really a priority area for our community. And for a lot of practitioners in this field. So I think it is very, very rewarding when we see, like public officials paying attention to some of the issues that we continue to discuss, kind of like, like every single week, every single month. So I think that's very rewarding.
Thank you for that, Anya. And thank you for continuing to push from your position within the government. Anybody else?
So I would like to tag on to what Anya said. I think the thing that keeps me coming back is learning sort of what policies or policy changes or areas of interest are being talked about and addressed at the policy level. And that it's really important for me to know that efforts are, or to try to help or facilitate efforts aligning in the same direction so that there's better chances of successfully making change. And I was actually kind of thinking that, I was wondering if the state, at some point, if we could maybe hear from the state health equity work group to see what their policy priorities are going to be in the coming year, and maybe look to see what they're doing, to see if there's something that we might be able to do locally that aligns with that work.
Great.
Thank you. That's really helpful feedback. So I heard
Oh,
discourse,
Amanda?
like moving the discourse beyond just small group conversations and having action, learning more about policy and how we can um, align our actions to what's happening at a state level, potentially. Amanda?
Yes, to echo Anya, today I went to this community listening session in Howard County, and a lot of residents felt like the data is there. Like they're tired of seeing the data, the health disparity data over and over again and not seeing any real change happen, like at the community level. I think in Howard County, the Black maternal death is 3 times higher than overall population. And that has been like a statistic that has been just increasing. And I mean, I'm not calling anybody out, but I'm just saying when there's like a disconnect between the policy at the policy level and then the community level, like there's so much data to support our work, but it's so frustrating to see residents just give up and just become hopeless because they're like, we've been knew about this stuff and there's nothing happening. But I really do echo Anya because I think this group does an amazing job to advocate for it at the policy level and with government agencies. And yeah, that's what I wanted to put my 2 cents in. Echo off of Anya.
Thank you so much, Amanda. I think what brings me here is because we all are change agents. We want to serve as that catalyst to effect change. And we are the voices of the community. And we're, through our expertise, not only at the organizational level, but those of us who are involved at the community level, we bring the lens of those who are affected or impacted by lack of access to healthcare, lack of access to health resources, and so forth. We are the ones that bring this information and disseminate it to the group so that we can help build and design those particular programs that can help address those particular needs. So I think it's again, imperative that we continue to keep in touch or connected with the community so that we, again, one, our priorities are in alignment, and just to piggyback on what Amanda had said, and two, that we can show progress. And I think with that, we need to look at our priorities and look at what we want to tackle and what sort of resources that we can leverage and what tools that we have in place to accomplish those. And again, it's all about partnerships because this is part of that collaborative framework that brings about change and what we call effective and efficient change.
And I see Rodrigo's hand.
Yeah, so I think just
Leave her.
sort of
Leave her.
expanding sort of like the guiding questions that have been prompted so far. I think an area that the work group might consider is especially around health and all policies, and sort of like what La Clinica's data gave back to us, and I'm sure this is relevant across different subsets of populations, is really focused on those material needs. Housing, so for example, I don't know, housing authorities, access to food. I know IPHI is here, and I know they had the Prince George's Food Equity Council, but really those material needs that then, or the social drivers of health, I think that could be some sectors that should be represented in this coalition. Additionally, from those material sectors, I think the other and pressing need that always comes up is income and occupation right. So I don't know if there's any representation around labor or workers organizations right here that are fighting for workers' rights, wages, because I think that is very well connected around how we understand the social drivers of health, and it really is a class dimension that is really manifesting in different ways. So I think that is a potential way that this coalition could consider expanding, really tapping on those material areas, and really then taking them with the labor, right?
Yeah, thank you. That makes a lot of sense, especially considering one of our strategies or goals really involving health and health policy, that we should also include membership and representation from people outside of the public health and healthcare sectors. Thank you. I also heard labor and workers' rights, right?
Yes.
Anything else? And sorry, Taylor, I know we jumped around, but I kind of wanted to make sure that we knew what could keep people here, the current people here, what they are interested in covering. So I'm hearing, so just to again recap, so here, staying aligned and aware of policies, changes with whether at the state level, even at the federal level, considering change in administration. I'm hearing take action, really listening to community and using and advocating the data that does exist to affect change. I'm paraphrasing a lot of different people's feedback. Anything else? I guess the next, okay. Sharon, I saw you.
Yeah, I mean, I think one of the areas that I have become most concerned about is Medicaid and we don't know. I just am one of these people, I worry in advance, right? What potential changes we might be looking at under Medicaid, because conceivably they could revert back to pre-ACA days when Medicaid primarily only covered children and people with disabilities, and that would leave so very many people in Prince George's County without health coverage. It would just unfathomable at this point how state or local communities would contend with that. But if we had sort of somebody who was very knowledgeable who could say these are the potential likely changes that are going to happen, just so that we have that on our mind as we're thinking about goals for 2025 and also where we might consider innovations that are needed.
You, Sharon. And Taylor, is that something that we may ask Stephanie Little to help us navigate?
Yes, that's why I wanted to put that question there in the chat for folks to brainstorm. So as we move through these questions, again, if there are any policy areas or topics that you are all interested in, we're hearing a lot about the social determinants of health, Medicaid coverage. Again, you all met Stephanie Little, the Chief of Health Policy and Innovation, new to the Health Department as of August of last year, and I'm hoping Stephanie will be an active member in the work group moving forward. And so excited to have her expertise and have some updates to her. So if we could take any of these topics back to her and have presentations and be able to stay in the know this upcoming policy season, I think that would be impactful and hopefully get folks more informed. More informed. And
I also want to add that, can you all hear me? I also want to add that I certainly can take stuff back to the state, and I meet with the other health officers once a month and the deputy secretary. So I'm sure we're going to have a conversation about that, and I can bring that up onto the agenda to see what the other folks are hearing as well, to see how we advocate for the Medicaid population in particular, but everybody in general. We have at the county level, we have been talking about going back for a second to the immigrant population vulnerabilities, we have been talking in the county about what possibly things we could do as well. So it's on our radar. I'll next time I speak with we go to the health officers roundtable, I'll ask these questions and I can bring them back to either Taylor or Stephanie if she's joining the call, and can give you an update, or I can join if I can.
And also just
Full
to
stop.
chime, and also just to chime in and add to some of the concerns that have been already brought up, such as maternal health services for our immigrant population, to our uninsured, improving food security. I would say that also for the Board of Health, behavioral health continues to be a big issue, and also just like looking overall at the county's capacity to deliver services. So not just like focusing on particular healthcare outcomes, but also in terms of like the investments that we're making. Our going back to the Huron report, our bed capacity, our number of practitioners, and I would even expand that further to, to urgent care facilities, to long-term care facilities, hospices, and other places. So looking even like at the structure of and healthcare landscape that we have, because obviously lack of tangible buildings and people contributes to inequities that we continue to see. Thanks.
And thank you, Christine, for adding those links in the chat. I know we've discussed previously, what do these documents mean in terms of a health equity lens. And so as we're taking a look at it, and I can work with some partners and see about getting us some presentations, but those would be some questions to ask yourself to take a look at these documents and see, what area of the issue may we address or be able to bring up and take a closer look at some of that data. So again, feel free to take a look at those links, and I will work moving forward to get us some presentations about more information about those documents. And I think we've talked a lot about content today. Just wanted to give one more opportunity if there were any other topics anyone wanted to mention, anything related to policy in the upcoming season, or overall just something that folks would want to hear more about, whether it be data or what we're doing currently in the county. And I see Sharon's comment and overview of state and local challenges and priorities. All right, well, continue to think about that. And as ideas come up, please do let us know, and feel free to email those over, or we will continue this discussion in future meetings. But also curious, if we're talking about empowering the individuals on this call, we want to make sure that we're consistently sharing information. And so curious if anyone has any ideas for how we can make this work group a more enriching experience for all of our volunteers, if there are more methods of information sharing, if there are ways that I can get you all more information from the health department, or if there's more information that you all would want to provide to the health department. I hope you are all subscribed to our PGHAC newsletter. But again, if you all have any ideas, like what Rodrigo mentioned, doing a partner presentation, please do let us know. If we want to do any member highlights to highlight what your organization is doing, how you are leading the health equity work in your community, please let us know. But any ideas on how we can enrich the experience, either for yourself as a community member, as an individual, or as an organization? And Amanda said here in the comments, partner spotlights, I'd like to learn more about everyone's work. Certainly, we can get that arranged. Any additional feedback? Okay. And then to close us out on an easier question, again, as we mentioned, we're trying to build up these orientation materials. So as we have new members joining us, we want to be able to provide them with content and process information about the work group. So if you all want to think about this, keep this in the back of your heads. What are 3 pieces of information that you would think that someone would want to know about the health equity work group? From your experience, whether it be about commitment to certain topics or how the process goes for these monthly meetings, feel free to brainstorm that, and you can put it in the chat as we finish up the meeting, or if anyone would like to share now. I see Ashley's comment, a more clear-cut goal and objective. So something that we can all get on board with and be able to easily conceptualize as we go into meetings and we talk about this great work group and what we're all a part of. Commitment of time.
Speaking specifically of with this question, several of you have joined more recently. What would you have wished that you knew before you joined or as you're joining? And if you don't think of it right now, you can always reach out to Taylor or the PGHAC email and share.
I don't know if this is applicable to this question specifically, but maybe opportunities that partners can collaborate on funding opportunities. So, for instance, if there's a funding opportunity out there, maybe there again to the point about having the community partner spotlights. Maybe an opportunity where folks can or organizations can partner for funding opportunities and ways that they can better partner together and collaborate. That may be a good option to consider. Again, not sure if this is applicable specifically to this question, but just something I wanted to bring up.
Great ideas. And Ashley Richardson, yeah, I know more clear-cut goals and objectives. Just wanted to respond to that. I think that's also why we're interested in hearing from you to make that more concrete, figure out how we want to show up. We are all volunteers. What do we collectively want this work group to look like? We've had some goals that have been lingering for years that we're working towards, but are there new things? Is there something else that we should be prioritizing? So thank you, Essie. So knowing what the group is, what they're working to accomplish, what the roles community partners can play in the meetings. All right. Thank you. I see it's 4:20. I think that was the last question, right? Okay. So now community announcements. There are a few that.
Yes, so excited to offer the Prince George's County Community Health Workers Training Program. I can provide a link in the chat. This will be starting up here shortly, January 27th. So this training opportunity is available to anyone who is interested in becoming a certified community health worker. So any resident of Prince George's County who is interested, and it will provide core competency courses and continuing education training for both new and existing CHWs. So if you are a current resident who is interested in becoming a community health worker, this is for you. Or if you are already a community health worker interested in taking those continuing education courses, folks can also engage that way. So again, this will be a free training offered to Prince George's County residents. So please do share it with all of your networks. And let me go ahead and pop that link in the chat.
And Sharon, it is free. I mean, if Taylor, if this is the training, I think it is. Yes, it is free. But
Taylor, you're going to also place this information in the minutes. Am I correct?
Yes, yes. So these slides will go out, all of the flyers and all the information. And then next, the City of Laurel Health Fair is taking place this Saturday from 10 a.m. to 1 p.m. And so we have the information here, a great way for folks to get involved and active in the community. Some great resources available for blood pressure screening, diabetes screening, flu vaccines, all of those great things. So anyone who is in the area, again, I'll share out this information with you all to be able to share with your networks. Lastly, that second link that you are all seeing in the chat, I'm going to extend that deadline for the partner survey. If folks wouldn't mind providing feedback January 31st for the coalition partner survey. So that partner survey will ask you all questions about the services your organization may provide, the population served. We want to get a better idea of the representation we have within the coalition. We want to know, again, who's at the table and who is not. And we want to make sure that we are identifying those gaps in 2025 and filling those service areas or those populations who we are missing. So this will be a great time, like Rodrigo had shared earlier, to be able to share about any data collection you're doing as well, so we can have that information available to plan these partner presentations and be able to do more member spotlights. So if you all wouldn't mind taking, hopefully it will take you about 10 minutes or less to complete that survey. I've put that link in the chat, and if you could complete that by Friday, January 31st, would greatly appreciate it. And before we close out, are there any community announcements or any updates anyone would like to share? Alrighty, well, thank you all very, very much for a very interactive, almost hour and a half. Appreciate you all hopping on today and sharing, and as always, being a part of this large vision for the Health Equity Work Group. We will convene next on Thursday, February 20th. Again, I'm going to send out that updated meeting link for you all for the new year. And in the meantime, just let us know if you need anything. And Christine, Dr. Cooper, I will leave it to you to close us out.
Once again, thank you all for attending. We look forward to us collectively working together to tackle those particular priorities that we need to address in the county. Thank you again in advance for all that you will be doing in the future. We look forward to working with you.
thank you all.